Somewhere in your nervous system, a traumatic memory doesn't just sit there like a photograph. It gets stored in a way that can make your brain react to the present as if the danger is still happening. The question this video asks is blunt. Can you actually change that? Not just cope with it, rewire it. Here's where the science currently stands, and it's more concrete than you might expect. Two of the most studied trauma treatments, eye movement desensitization and reprocessing, known as EMDR, and trauma-focused cognitive behavioral therapy, known as TF-CBT, have both been examined not just for whether people feel better afterward, but for what's actually happening inside the brain during and after treatment. That's a meaningfully different question than, does therapy work? It's, does the brain measurably change? Start with EMDR. The therapy itself involves recalling a traumatic memory while performing bilateral stimulation, typically guided eye movements, sometimes alternating taps or tones. The theory is that this process helps the brain finish processing a memory that got, in a sense, stuck. For a long time, that theory was hard to test directly. Then neuroimaging studies started looking. In patients with PTSD, EMDR therapy was associated with significant functional decreases in activity across deep gray matter structures, including the amygdala, the thalamus, and the caudate nucleus, alongside decreased cortical activity. That matters because the amygdala is central to fear processing. A traumatic memory that keeps triggering an amygdala response is, roughly speaking, a memory the brain still treats as an active threat. A measurable drop in that activity, following treatment, lines up with what clinicians see behaviorally. Patients who can recall the event without being physiologically flooded by it. There's more specific evidence, too. Some studies found a decrease in gray matter volume in the left thalamus following successful EMDR treatment. And that specific change has been proposed as a possible neural marker for symptom improvement. In plain terms, an actual structural shift in the brain, not just a change in how someone describes feeling. TF-CBT shows a parallel pattern. Structural and connectivity studies comparing trauma-focused CBT and EMDR in single-episode PTSD patients found that both interventions produced beneficial changes in brain connectivity and in validated clinical symptom scales, with neither treatment clearly dominating the other. Two different techniques, converging on a similar result: measurable brain change alongside measurable symptom change. So, does that mean the science has settled this? Trauma is fully rewirable with the right technique? Not quite. And this is the honest part. The American Psychiatric Association currently gives EMDR a conditionally recommended rating for PTSD. Not because it doesn't work, but because the strength of evidence, compared to some other treatments, is rated lower. Conditionally recommended means there's real evidence of benefit, but it's not as robust or as consistent across studies as the field's top-tier recommendations. That's a meaningfully different claim than proven to rewire trauma. And it's worth sitting with, rather than smoothing over. There's also the deeper question of what rewiring actually means here. These studies show correlated brain changes alongside symptom improvement, decreased amygdala reactivity, altered thalamic volume, alongside a patient who can talk about the event without a flashback. That's genuinely significant. But it's not the same as proving the treatment directly causes a specific, permanent structural rewrite, the way you might imagine flipping a switch. Brains involved in psychotherapy research are hard to fully isolate from everything else happening in someone's life during months of treatment: sleep, stress, relationships, medication, time itself. So, can you rewire your trauma? The honest answer is, something real and measurable does change. In brain activity, and in some cases, in brain structure, alongside real symptom relief across more than one independently studied treatment approach. That's not a small claim, but conditionally recommended, not guaranteed or fully understood, is where the actual evidence sits today. The brain that processed the trauma isn't erased or reset. It's measurably, partially, and non-uniformly changed by treatments that work for many people and not completely for everyone. If there's a version of hope, if hope worth taking from this, It's not that trauma is simply undone. It's that the nervous system is not simply frozen in the moment it was hurt. Pathways that lit up in fear can, with real intervention, light up differently. That's not nothing. It's also not everything. We'll be watching as imaging techniques get more precise, and as longer-term studies clarify how durable these brain changes actually are, years out from treatment. Because that's the piece the current evidence still can't fully answer.